Good afternoon. I'm Brenda Metzler. I'm a community and program support specialist with Let's Grow Kids, and I'm happy to co-facilitate, kind of MC our conversation today. And I see that people are still joining us. So I'm just going to give it about 30 seconds or to a minute more, and then I'll make some introductions and hand it over to the folks at the Vermont Department of Health. So we'll get started. Again, I'm Brenda Metzler. I'm a community and program support specialist with Let's Grow Kids. And we are so pleased to be able to bring you all together again today. I can't remember if this is the fourth, fifth, sixth, more, whatever. It's a really nice tradition we've started here of inviting the Vermont Department of Health to come and talk to the early childhood community here in Vermont. And so we have Sally Kirshner and Margaret Tarmy, and later on we'll have Rena Holmes. We also have Caitlin Kodzis joining us today, and they're going to give us a presentation with the latest up-to-date information and data concerning us and Vermont and COVID. And then there will be time for questions, and you'll see that there's Q&A and a chat. It's really, really helpful for us so that we can capture all of your questions, and especially if we don't get to answer them live, for you to use the Q&A feature. So please type your questions into the Q&A, and if they aren't addressed during the presentation, then we will get to them during the Q&A time. So thank you for joining us. We seem to have a momentary glitch with advancing the slides, but as soon as we can advance the slides, we will get started.
There we go. Hi, this is Sally. People can hear me, I am assuming. I'm Sally Kirshner here at the Health Department, along with Margaret Tarmy, and just to say, Caitlin Kodzis has joined us. You folks all knew, or still know technically, Sharon Lee Treffry, who retired at the end of December. And we've been very lucky to be able to hire immediately. And Caitlin is the school nurse consultant that is in Sharon Lee's position. And she's joining us and learning about all the things that are going on in Vermont. She's studied in Maryland and brings a lot of new great national experience from her graduate school from several years ago. So we're just really excited that Caitlin was able to join us so quickly and is on this presentation. Here's an agenda. Depending on how we get to the different questions and all, and when Brina joins us, we might move things around a little bit, but this is basically the topics that we wanted to get to today. And next slide talks about housekeeping details. Okay, and there's a question about do people need to resubmit questions? And I don't know, we've answered some of the questions that people have already sent us in the slide deck. So obviously towards the end, if you think we're not getting to it, you can certainly resubmit. And if there's repetition, Brenda will help us overcome that so it doesn't get too repetitive. This is the slide just reminding us, even though we shouldn't need a reminder, to thank all of you on the front lines for all your work. You've been such leaders in keeping our children safe. And children, I kind of say this, it's like you're working with our youngest children in Vermont, but what you've learned in the spring and the summer helped inform us how to keep school-age children safe too. And you're continuing to slog it out. This pandemic gets longer day by day, and we just want to say thank you, and we are so pleased, and never forget all the work you're doing on the front line here at the health department. So thank you. Yeah, Margaret was going to talk some about vaccines, which is a hot topic, and luckily we can talk about them because they're here in a small amount.
Thanks, Sally. So hi, everybody. I'm Margaret Tarmy, and I'm a public health nurse in the maternal child health division. I've been on the school and child care branch since March, and really wanted to just take a couple minutes to just provide some information on vaccines, as Sally said, and you all have verbalized it's a hot topic. When Brina joins us a little bit later, around 1:30, we're hoping to delve into it a little bit more if there's still more conversation to occur. So as far as vaccines, Vermont is really approaching our supply by using the age grouping to determine who's going to be receiving the vaccine next. And this is based upon our primary goal to save lives. So as you might know, we began the process of vaccinating in end of December, and the first group were 1A, designated healthcare professionals and residents at long-term care facilities. We have essentially finished the first doses of long-term care facilities and a lot of healthcare workers. So we've vaccinated 36,000 people with their first dose so far, and around 6,000 have completed their second dose. So up next, as far as the cohort or groups that are designated for being next in the vaccine campaign, starting Monday the 25th, Vermont residents age 75 years and older can get vaccinated. Starting on Monday the 25th, we are standing up a large call center because this has been a very popular inquiry to our health operations center. So we will be able to support people with registering for vaccine online and by phone. There's anticipated about 50,000 Vermonters that are going to be in the 75 and older age group. So we, after vaccinating them, will proceed with 70 and up, and then 65 and up as vaccine supplies allow. And then following that, Vermonters with certain high-risk conditions. You know, I guess I just wanted to say that every person who gets a vaccine is one step closer to herd immunity. This is going to take time, and it's certainly been a challenging process. I guess the last thing I wanted to say on this slide is that as far as those with high-risk conditions, just to specify this further, we're speaking about people currently with cancer, emphysema, chronic kidney disease, heart conditions such as coronary artery disease, congestive heart failure, cardiomyopathies, pregnancy, type 2 diabetes, sickle cell, severe obesity, and immunocompromised people, and Down syndrome. Next slide, please. The hyperlink there, the vaccine dashboard, we do have another section of our website that is tracking the administration of vaccine, and you're welcome to take a look at that. Vermont is ranking second in the Northeast for rate of COVID vaccine administration. We're top 10 in the US, and feeling pretty proud about that. This is the biggest, most massive vaccine campaign we've ever had to embark upon, and it's very complicated. As far as who the vaccine is for, the Pfizer and Moderna vaccine are approved for ages basically for adults. Children under 16 cannot get the vaccine, and it is indicated for pregnant and lactating women. As we kind of move forward with a new president and potentially our new president may make some other decisions with, pushing out vaccine, our commissioner, Dr. Mark Levine, has made a statement that ultimately there's no science behind just giving people one shot to a large population and sort of the hit or miss with the second. So at this time, we are definitely subscribing to honoring the promise of, we've given you one shot and we have your second reserved. Next slide, please. Sally.
Yeah, so I can give a quick overview. This is a slide we've shown before just to remind folks about the guidance and resources that are on our website. And I think a lot of you folks are very familiar with this now. We have the K through 12 Strong and Healthy Start guidance that is on the site that was revised and updated mid-November. There's the childcare guidance from the end of August, which seems like a long time ago. We've looked at it. It's still accurate. And, right at this minute, we're not actively updating it, but we're keeping an eye on it if that should need to happen. We have updated the K through 12 over the summer and the fall, but that's kind of as it is on the website with the date of November 16th. Folks have been calling us and reading about the multi-household gatherings, and there's a lot of information on our website about that. It can be a little confusing, but basically it's like more that like households are not to be gathering, because we're finding in the quote community spread, that's how we're seeing most of our cases being transmitted from person to person. Over the Christmas and New Year's holiday, the governor allowed 2 families to get together with a lot of caveats. And we think that did help allow some people to get together and have a bit of a Christmas together and really minimize the risk of transmission. But now it's basically multi-household gatherings are still not allowed. But then like back to 2 people walking together outside for a recreational activity can do that kind of thing. So again, it's how to make it so that people can do a little something, but not have it get out of hand to the point that it's an event that that creates possibility of spread. We're hearing a lot this week about slumber parties and things like that that are concerning, and that made me remember last summer you folks called a lot hearing about this play dates and that sort of thing, and it's just anecdotes. We're not following it by quantitative surveillance, but we're hearing a little bit more about that now and worrying that I'm sure people are getting tired of being isolated and due to this pandemic, and sometimes people just need to bust out because we're all human. The governor is allowing some more activity around sports in both the rec leagues and the school-sponsored sports, about I think it was scrimmages and practices, but not games with other schools, and also not games out of state with teams that are in other states. So that's there in the winter sports phase is on the website also. You may know that there's a great daily update of the COVID data, and also just some narrative updates every day. I read them, I learn a lot from them, and I think it's great that we have that posted on our webpage for everyone to see. There's also a table showing the numbers of cases in a school, not necessarily associated with the school, but ones that were in people who are in school while infectious. This is the K through 12. We haven't been able to do that for child cares. That has been a request from this group and others it requires a lot of background data analyst work and a lot of data scrubbing. I learned that term when I first came to work at the health department. You have to make sure you have clean data, it's all scrubbed and all the denominators are congruent and that sort of thing. And right now our data analysts don't have time to do that. So that's like on a request list to see if they can dive a little deeper into the data around childcare. Also the community, back to the community positivity rate, what is that, like 2.7, I think is our latest. That's on that link there. And that's the number of cases positive over the number of tests. And that's a way that we use to gauge community transmission. And in some states, it's like 20%. And in Vermont, it's 2.7, 2.9, and it's staying under 3.0, which is where you start getting nervous, 3.0, 5.0. Also on our website is the continued advice for not to travel out of Vermont unless it's essential travel. And you folks, again, had helped us figure that out last summer with the family whose father routinely works, across state lines, or you'd have some children and staff who cross state lines to come to your childcares and preschools. So your questions helped us understand that that was something we had to work out. There's the Sarah alert. That's the texting that people get. Excuse me, I'll get rid of Mara now. The Sarah alert is what people can sign up on. It's like a texting app that helps you monitor your symptoms if you've become positive for COVID. Some of you may have experienced this yourself or with people associated with your childcare. It's just a great way to monitor and keep an eye on symptoms and an early alert for if they start to seem like these are getting a little worse, we should be calling the physician to make sure it doesn't get into anything more serious. And the other thing that's not on here is that they've started this texting to people who've been named as close contacts. And you just receive a text from the health department saying you've been named as a close contact. You're going to get a call from the health department. So don't freak out when you see it, but expect it and start thinking about that you may have been exposed and making plans that you'll probably have to quarantine, that kind of thing, kind of like a early warning that the health department is going to call you. So that's a quick update of that slide. Next slide. Yeah. Oh, and this is, we talk about this all the time when we're on the phone and you folks call and say, what can we do? What can we do? And some of it is just do what you're doing. Margaret calls it the armor. And this is so effective. And why we keep saying that schools and childcares really can be very safe because of all this tedious but important work that you folks do every hour of every day when the kids are in your center. Next slide.
Sally, I'm going to jump in and say there was I'll just interject and say there was a question in the chat box, like sort of how long do we need to kind of continue to kind of keep up all these mitigation efforts. So just wanted to, for right now, respond to that and say that as we go forward in this vaccine campaign, and it will take time for us to reach herd immunity when 80% of our population is vaccinated, we will need to maintain our armor or our mitigation efforts until we are through this. I just wanted to say, I think we skipped a slide too.
Yeah, I was just looking at that. Should we go back? The algorithm about return to care.
Oh, I guess it's, no, it was the recovered from COVID-19.
Oh, right.
That's okay. Never mind. We'll move on. So this is the next slide in our deck. Sorry about that, everyone. So, back to kind of what we were saying, your mitigation efforts are essential. This one being a really important one. So, continuing to screen people for symptoms and excluding them when they're sick. You all are, I'm sure, very familiar with a document that we produced that helped give some guidance about if people had certain symptoms, sort of, if they need a COVID test or if they maybe should consider getting tested or have a discussion with a healthcare provider. And then part of that guidance incorporates criteria for when they can return to care. So we're in the thick of winter, people, and I guess as we are tired and exhausted from these mitigation efforts and everything associated, just really wanted to say thank you for continuing to keep a high guard and high guard with excluding people when they're sick and following when they can return to care.
Okay.
Next slide.
So you folks may know some of this by now. This is our warm line that is where we staff it, Margaret and I and several of our colleagues from 8 to 3. That's the number, punch number 5. And then after hours, punch number 7. And that's the late afternoon, evening people, and that's also where there's coverage on the weekends. Margaret and I and our colleagues are on the school childcare branch. That's our team that we provide technical assistance to you folks. We take your questions and concerns and try to formulate that or help that inform future guidance. And then we work closely with the OPRs, what it's called, the Outbreak Prevention and Response Team. And they're the ones who will work directly with a childcare or a school if there is a case that's associated with the school or in the school while infectious, and they work closely with the contact tracing team. So that's kind of how all 3 of these groups of people work together and coordinate. Yeah, next slide. This another link. There's again, I keep thinking a lot of you know this because we've talked so much, and I don't know, sometimes when you call and I start to give you an answer, if you get me on the phone, it's like you're telling me, because you folks know some of this so well because you've been through it either with a case in your childcare or just because you're good at what you do and you read the website, you know how to interpret it for what you need to do in your practice. But we have several diagrams on the website as to what, how to interpret if someone's been exposed, when is their isolation period, the 10-day isolation, the 14-day quarantine, you can test out at day 7. More recently, the last many months, since we've beefed up our ability to do the contact tracing and the testing, and we've seen more and more community spread, our commissioner, Dr. Levine, is saying, if you think you've been exposed, just go get a test. And then as you find out if it was more of an exposure, so you could do a test right away and one within 7 days. You could even do 2 tests. Last spring and summer, we couldn't offer that because we didn't have enough tests. So we were listening to Dr. Levine this morning on a presentation, and he was saying that's one of the main reasons why we've been able to keep it so in control in Vermont, even though we've recently seen more cases than we would like. We're able to grab those cases and get control of them immediately with our robust contact tracing and the ability for people to get tests now on demand. You probably remember it was really hard to get a test. So that's on this link, and that would be the next slide. Oh, there's one. That's these nifty little graphics. So here, as I say, I think you folks know this, recent exposure, day 7, you can opt out early by getting a test. The incubation period of the full time of 14 days, quarantine. So these are on our website for further reference. But even I look at these, if it's a real case and we're doing the numbers, counting before and after exposure, I always have to ask because it can get tricky. So next slide. And here's more links as I was describing. Okay, the next slide. Oh, here's Margaret and her nifty data grams.
So it sounds like in December, there was, certainly some interest in just having a little bit more data related to childcare, COVID cases and transmission. And we did share that in December. We and our data team have been very busy associated with the holiday surge. So we don't have anything super specific to share about cases in childcare and transmission in Vermont. However, did want to scale up a bit and provide some macro data and some other studies to just help address potentially some of your questions or concerns. So this slide, as we've been chatting quite a bit about percent positivity, so this is a slide of what our percent positivity of COVID-19 has been since the pandemic came to visit in March. So, when we had the complete stay-at-home order, our percent positivity was like 11%. And so currently, as Sally was saying, last week, our average percent positivity was 2.6. And the past 2 weeks of January 6th through 13th, it was 3%. So we are, doing well with that. And again, that's really a marker of how well contained our COVID is in our community, which is essential to, prevent going into a complete lockdown where we have rampant community spread. Next slide. So I'm sure you're curious a little bit more about how COVID is presenting in children and really what the prevalence is in our youngest age group of which you're caring for. So I did want to talk a little bit more about this slide. So generally speaking, COVID rates are highest among Vermonters in the age groups of 20 to 29, and then in the age groups of 80 and older. Children are representing 17% of Vermont cases. So certainly less than a quarter of cases are within children. And some additional data is that older children have a higher rate of COVID compared to younger children. So by older children, ages 10 through 19, have a rate of 146 per 100,000 per 10,000 Vermonters, and then the 0 to 9 group is at 88.3%. So bottom line being, the children 0 to 9 have a lower rate of COVID compared to older children or even the adult population. I think it's really interesting to take a look at how COVID is presenting in children. So one of the most common signs or symptoms is a runny nose at 51%. And then the second most common symptom is a headache at 46%. And then third being cough. Interesting to note here on the right side of the slide that we are seeing that children are probably the biggest age group to be asymptomatic without any symptoms. So the percent of COVID-19 with no symptoms is higher among children. So I think that that's pretty interesting. When children are sick with COVID, their average illness duration is 5 days. And some other interesting data points are that among Vermont's children with COVID, there's no reported cases of multi-system inflammatory syndrome. There are no deaths, and there are fewer than 6 hospitalizations in ages 18 and under. There have been no children under 18 that have been hospitalized. Next slide. We often get requests for science that supports our policies in our school and childcare branch. And like I said before, I know you guys are very eager to have really specific data telling us the story about the prevalence of COVID in childcare and transmission in particular. So what I did want to bring you today, since we are without the capacity to offer you that ongoing at this time, is just a real snapshot of what we call MMWRs. So this is the MMWRs, if you're not familiar, are often called the voice of the Center for Disease Control, or CDC. This is the agency's primary vehicle for scientific publication, timely, reliable, objective public health information and recommendations. I want to do a super quick summary, and you can hit the hyperlink if you want to when you guys get the slides later and read all about it, or just not. But anyways, really interesting science about all of our mitigation efforts. And so I want to just provide a few snapshots about these. So the December MMWR, this was basically the conclusion is that kids, so children and adolescents ages less than 18 in Mississippi, if they had a close contact with a positive case, or if they gathered, meaning a social gathering, meaning you're hanging out without a mask, you're within 6 feet, probably inside somebody's house, you're gathering with someone outside of their household, or if a lack of a mask consistently in school, those are all factors that were associated with being positive. Whereas the opposite, the contrast is that attending school or childcare were not associated with having COVID. So basically, you're more at risk to get COVID if you're in close contact with a positive case, if you're at a social gathering, and if you're inconsistently using a mask. The highlights from the August MMWR are, this is really all about childcare. So if you haven't heard about this one, this might be of interest. Really, this study tells us that there is limited secondary transmission, meaning you have a case in childcare and somebody else gets it. This was done in Rhode Island, and really the big story here is that the childcare program's adherence to all of these mitigation efforts. So we're talking about masks on faces, we're talking about class sizes of 20 in childcare, and then other mitigation efforts, not letting them in if they're sick, cleaning and disinfecting, all the commonly touched surfaces, all these things that you do prevent secondary transmission in childcare. Moving on, so the January MMWR, the real highlights here, this was basically after schools were open, the CDC took a look at kind of all of the schools. So we had 2/3 of schools in the US that were offering either full in-person or hybrid learning, or partially in-person learning, and sort of despite schools being open and people being together in these spaces, there was essentially a very low level of outbreaks despite schools being open. The other thing about this is that just kind of confirms that ultimately we are seeing the incidence of COVID being consistently lower in children 0 to 10 years of age. And this MMWR in January also just really drives home that universal and proper masking is key to preventing spread. And also when you have communities that are contained, or again, have that percent positivity rate low, then we can keep COVID out. So those are key things. Keep the masks on, and we've got to contain COVID in the community. Once it's, at a higher rate, it's really hard to keep it out of places. So I'm going to move on. I don't think we need to get into the last one. Oh, Brina's here. Hi, Brina. So these last slides are really just about, contacting us, and we know that there's been a bunch of questions as well. So I think that's it for sort of what we had officially prepared, and want to bring Brina into the fold here.
Welcome, Dr. Holmes.
Hi,
so
everyone.
good to have you.
I'm hoping you can hear me.
Yes.
Great. Does everyone want me to take it away? I know we have we put some of the questions in the slides to follow here, but is it okay if I make a few introductory remarks? Sorry for the coming in the middle.
It's perfect timing,
Okay.
Rena. And again, if we
Great.
don't get to all the questions, we can respond in a document to Brenda and Kathy and colleagues. So go ahead.
Excellent. Okay.
Thanks for your time.
Well, first of all, hi, everyone. Knowing I was going to see you today, I did a fair amount of reflecting. I can't believe how many months it's been since I was talking directly with childcare providers and early educators. I just really needed to start with gratitude because of where we were in March, in April and May together. And it's really in hindsight that I just recognize the extraordinary courage and engagement and willingness that your field and all of you took on at the time when we knew so little about this virus and where we were heading. We know so much more now. And I think the other piece of gratitude for today is the school and childcare branch at the health department, many of whom, or some of whom are on with you today, Margaret and Sally, and our newest member, Caitlin. I assume you introduced Caitlin at the beginning. I love seeing Caitlin. So this kind of nexus of your public health team and your incredible field of providers it feels really good to be talking with you today. But I also know that there's still a lot of concern, a lot of fear, and a lot of unanswered questions. So we're going to live in that space together, but I just really know that our partnership is a lot stronger than it was when we first started. And thanks for sticking with us, because the kids in this state and families have benefited deeply and greatly from your kind of can-do attitude and your commitment. So that being said, Margaret, do you want me to pull up the slide questions, or did you already address those? Or
I'm happy to group them
through the slide Q&A or the Q&A in
good.
the chat.
Okay. You did. So you did not do the ones on the slide, because the chat. You guys know this artifact of Zoom. When you join, it starts real time. So anything that happened before 1:30 is not visible to me, which is true. So I know you addressed vaccines, but I feel like I want to give you sort of the Brina spin on that. And then Brenda has a question. I see only Brenda.
So I have a number of questions that would have come up before that you can't see, and some of them do pertain to vaccines. And so I'm happy to ask them whenever you're ready. You just cue me and I'll bring them out.
No, I think that's the most interactive way to do this. And I'll make some general remarks about vaccines at the end, but let's see where people have the most question and manage that for me, Brenda. I'd appreciate that.
Okay, well, so good to have you, Dr. Holmes. And we had a number of questions. So one of them is, we were talking about how the vaccine are being rolled out sometimes by age groups and also by risk conditions. And so a couple of the questions go to that. Will vaccine clinics be asking for age verification or verifying where people are coming from, or asking for high risk condition verifications?
Okay, so important. So this is going to be an empty offer because I know you're all caring for children, but tomorrow at 11 o'clock, the press conference is going to be entirely about the logistics of how the state plans to register, stand up clinics, and verify age, which is the first strata of the next phase of the vaccine rollout in Vermont. So I know that the health department is the state is contracted with 400 human beings to do a phone bank to answer questions, because the online registration system is quite concerning for all of us, but for folks who may struggle with technology, which may line up with age. I have to be very careful not to make that assumption, because I'm terrible at technology. So stay tuned for that. You're asking a great question that I think is being answered like today. There have been many stories around the country of people self-attesting their age. So I live, you guys know me, we've talked for years about the strength-based approach to being on the earth. I live in a place where I believe everybody wants to do this in a way that is truthful. There, of course, will be outliers who fib, but I don't, that my brain doesn't want to, so there's a general principle here that I want to share, which is you're going to hear anecdote of people getting vaccinated and you're going to wonder why. You know, a pediatric colleague called me about an architect getting vaccinated. You know, and what our ethicists at UVM and the people that are really thinking this through with me have said is we have to allow for multiple lanes and anecdote and know that every human in Vermont that gets vaccinated benefits us all, because it's a absolute just volume that we need. And this is a really difficult time we find ourselves in with a scarce resource, and everybody deserves this vaccine. And trying to put us in an order of who deserves it most doesn't work emotionally, philosophically, psychologically, ethically, because it's not fair. That said, those of us that spend their whole life in the protection and the care of children want early educators and teachers vaccinated. All of us do, because we know what you've done since March. We know the long-term impact of the disruption. And it's super important messaging, because we're not coming forth before you and saying, oh my gosh, it's such a high-risk situation you're in. We got to get you to the top of the line for vaccination, because you're not in one of the high-risk situations, and that's awesome. And that's because you've worked so hard at masking and staying home when you're sick and the other mitigation strategies. So we're in a circular conversation that we've created safe environments for children, but cases sneak in, and then there's massive disruption. So there's no like reality distortion here. We know that when you have children or teachers with COVID in your centers and in your homes, it's not good for society, because it disrupts people and the care, and the ripple is quite significant. So that's the argument to getting you on the list. It's not so much that you're in a higher risk or unsafe situation. So it's circular. I do know that I want to make people comfortable in the kind of iteration of this, because there's some hope in my brain about the supply. And there's a third vendor coming on. You know, Johnson & Johnson's vaccine is going to be approved in the next few weeks. And then we have a new administration in Washington who are going to talk more straight with us about where's the vaccine and how's it going to get here. And right now we get 8,000 doses a week. And you guys know the population of Vermont is 625. Well, you have to do the over 16 population because the vaccine's not approved. So I'm sorry I'm using so many sentences. We could talk about this so long, but we've got you. Like Sally, Margaret, Brina, Caitlin, you're our people. We've been with you since the beginning, and of course you need the vaccine. It's just that our governor is doing something that I do admire, which is he's not overpromising. He's only got 8,000 doses this week. And the people that die from COVID are over 65, over 70, over 75. He's just going right there. He's got one principle at play. And you guys know, both of my sons are public school teachers in Massachusetts. They've been promised the vaccine, which is pretty thrilling, right? They're next, except how on earth are they next? Massachusetts only has 30,000 doses, and the next cohort is being promised to 2 million people. You see what? So I'll stop there, Brenda. Now you got me on my.
No,
I just really want us to keep talking, right? We have to keep talking because we don't want you to feel left out. And you need the support to know that there are people advocating for you and understand what you do every day.
Yes. You get at some of the other questions, which I think you said at the beginning, you can't give us a magic answer. And, people are curious about, for example, in the presentation, it was mentioned that folks with Down syndrome would be near, sort of in one of the next groups. And, sort of like, how is it decided which developmental disabilities or pre-existing conditions take priority, et cetera. So, and what I hear you saying is that it's hard and folks are doing the best they can with the data.
Oh, I love that feedback. I can speak to chronic conditions because I'm on that group as well. That's all research data since December. We just have the 1 year of research on this darn virus, and it is a beguiling virus. And early on, there was a deep concern that respiratory disease was the biggest risk factor for a bad outcome for COVID. So children, we have so many children with asthma in Vermont. Asthma has fallen off the list of diseases that confer the highest risk. So something's up, right? I can give you my scientific theories about inflammation and what asthma is in terms of an immune response, but it isn't fully borne out by years of research. So on the group that Harry Chen is convening, he's our former health commissioner and a very trusted neutral party. He doesn't work for the administration. We have looked at all the research from the CDC about every condition on that list, and it just goes rank file. There's no subjective decision. And I'll just tell you, because I'm a straight shooter, people who are morbidly obese, which is the clinical term when your BMI is above 50, and then 40, are at very high risk for COVID. So they're very high on the priority list. Smoking people are also high on the list. And Down syndrome has some research behind it, and it is associated with really significant outcomes for this virus. So it isn't pitting disability, developmental disability diagnoses and patients against each other. It's just based on who came to the hospital, who went on a ventilator, who died, and it's just in order. So that also is a very interesting ethics. You can imagine in pediatrics, we have our disease understanding that's different than adult doctors. We're very worried about children with cystic fibrosis, children with asthma, children with chronic lung disease, but they're not on the list. It's just heart, chronic kidney disease, diabetes. So it's an adult disease too, which is just becoming more and more clear with the data. Okay, I'll stop again, Brenda. Whew.
Well, no, it's what I realize is we always run out of time for the questions. I'm just going to interject here, and I think I did forget to say it when I welcomed everyone, that these slides will get posted as soon as possible, I imagine by the end of today, on the LGK website, and so you can find them there. As you may have noticed, if you tried to click on any of the live links during the presentation, they're not live during the presentation, on your screen, but they are live in the slides that are posted on Let's Grow Kids website. So we will post them almost immediately after we're done talking here. And another virus related questions, and then just a host of questions about practice. And the virus question is really, I guess, probably conjecture, or prediction at this point. And that is, do you sort of foresee a time when this will just be added to the list of childhood vaccinations, a COVID vaccination?
Yes. Let's spend just 2 or 3 sentences on the prognostication here. So the current thinking is that when a high enough percentage of our society has antibody to this disease, either through vaccine or having acquired the virus, this will shift into a seasonal or an episodic viral experience for our citizens. But what remains to be seen is, does it shift into childhood the way other viruses have? And there's conjecture that that's exactly where it's headed. So it becomes a less virulent, less significant, but more common virus of childhood. And in that context, it would be a vaccine preventable disease with regularity, like flu. You don't get flu protection forever. It has to be tracked and managed, and you have to be vaccinated annually. And some of the scientists are hopeful this is not an annual experience, that COVID protection for children could come in every couple of years. But that part is very hopeful to me because there's people that are thinking that way, which means we're imagining the recovery instead of being still squarely in the pandemic.
So, and then thank you for that. There was one question about the SARA alert. Is that only for contact tracing in Vermont?
Oh, I sure hope Sally knows that. I don't know.
I think that's a national program that Vermont adopted. I think it was available to all the states. And several months ago, Vermont started doing the SARA.
Thank you.
And you can have SARA alert if you've traveled,
Yeah.
or if you are in quarantine, or if you're an active case.
Thank you. And then there were a couple of questions about the map, and I had one queued here. One of the questions was about how often the incidence map, sort of the region by region incidence map, gets updated, and how it could be a little shocking to see 13 new cases on one day and the following day have 23. And so how often is the Department of Health map for new cases updated? Yeah, I think that will cover all the questions about that.
So the interactive map on that amazing website is a daily update before 11 a.m., except some rare holidays where we give the data team a day off. If you see a big jump in your county, there's two reasons. Either something happened, very public in Addison County, that there was an outbreak at a church, or rarely it's a catch-up data thing where UVM, I shouldn't call out UVM, but a lab batched some of the results, and then it took a few days, and then now you've got 4 days of results coming in under one data shift. So what I always tell people, I'm from Addison County, and people call me all the time and ask me what happened yesterday. Like it's this real time, there must have been some. And when I've investigated it, just to sort of allay people's fears, it's those two things. Either there is several dozen cases from one situation, or it took the data a few days to catch up. I hope that's helpful. I love that you guys, I hope people really use that data, because there's a whole team of people getting it ready for you every day.
So thank you for speaking to that. We have probably a little less than 4 minutes left, and we have a couple of questions, some questions I think which could be clumped together. And there were several questions about different levels of the preventive measures that folks have been taking. And there are some folks who say, we've removed the fabric things, and if we wash them every day, can we please start bringing them back? And have we thought about having all preschoolers wear masks? And how long are we going to have to keep keep doing these practices?
Yep. I know Margaret, I think, addressed it earlier. The cloth thing's really hard because we're not going back in and revising the guidance, because we did it 5 times in the first 6 months, and we feel like we got to this place of really solid strategies that were working. And so to go back in now, as you know, because the transmission on surfaces is lower and lower based on more and more studies. So to go back in and add back puppets or add back in cloth, it feels too arbitrary currently. So I know that's a big loss from a developmental learning perspective, but that's our current January thinking. We are going to revisit the school guidance, the pre-K through, well, how the pre-K thing is complicated, but the pre-K that's associated with public education up through grade 12. We're going to hope to go back in February to look at that together, and it might be an opportunity to think about this mask piece. I just want to really compliment you and thank you for accepting the imperfection there, that we really stuck with a strong recommendation for masking in our preschool programs associated with homes and centers, but we aligned the required mask wearing with the school guidance. So I would say that has generated more phone calls than we would have preferred, but we didn't want to go back in and make childcare required because of child development. And we're so impressed and sort of heartened by how well it's gone that to make it like a mandate for 2-year-olds, like some other states have done, didn't feel right. So we're not going to really revisit the mask thing from my perspective for now. And I'll stop there. I think there was a third part, Brenda. There was cloth mask.
Yeah, it was about the cleaning practices, and Margaret had spoken to that earlier in, I think, sort of in the presentation, even just about like we are going to continue to do the sanitation practices. And at this point, and we're like 1 minute from time. So I don't know if there's anything you'd like to add to that. And I want to acknowledge that we have half a dozen questions left, and that what we do with these questions is we give them to Margaret and Caitlin and Dr. Holmes and Sally, and they answer them, and we post those answers on Let's Grow Kids website. So all of your questions will be answered, if not live.
And people.
Yeah,
can
I will
call
just
us
add,
too.
just for the big picture, that the facility management people in the public education system have asked for a seat at the table of the task force about schools and the guidance. So if we reconvene, we have facility guys, and they have asked explicitly to get more clear on cleaning and disinfecting and the frequency. So anything that we can pull from science to get right, we will make sure is reflected in the way that you do your very busy days, because we know it is a lot. So if we can make a shift, we will, and it will be, in the next 6 weeks.
And I think the early childhood community will be among the first to know when that happens. So thank you. And I'm so glad to hear that that those folks will be at the table in the decision-making process. I just want to thank again, Sally Kirshner and Caitlin Kadzis, Dr. Lena Holmes, Margaret Tarmy, for joining us today. And for all of you early childhood educators from around the state, I can see your names. So I know that you're here from all over the state. Thank you for being together, coming together today and making time to get some really up-to-date information from people who are on the cutting edge of what the best information we have. And we will post pronto this whole slide set where all the links will be live. And within, I think, 48 hours, we will answer all your questions. So that's our best effort. We'll do our best to get the answers to the questions out posted as well as soon as possible. And I think that wraps us up for today, but we'll see you again next month. Thanks, everyone.
Thanks, everyone.
Thank you. Bye, everyone.
Thanks,
Bye.
Caitlin.